How's it going, guys? Medium difficulty question pulmonary, 29 weeks gestation, male with NRDS, neonatal respiratory distress syndrome. What are we going to see? Now, firstly, you need to know that even though preterm is under 37 weeks gestation, that NRDS classically occurs under 34 weeks. Now, for 2CK/step 3, you need to know that you give 2 boluses of corticosteroids within 24 hours of parturition if under 34 weeks. So they'll say steroids were given 12 hours ago. What's the next best of management? Answer, steroids. It sounds weird, but you have to give 2 boluses, not 1. Another point is that if a kid is born 32 weeks gestation or younger, you have to give magnesium also for neuroprotection. Now, what are we going to see in this patient with NRDS? Choice A, decreased elastic recoil is wrong. Elastic recoil is the ability to collapse. Compliance is the ability to expand. Surfactant is lipophilic. It prevents the alveoli from collapsing. It's a lubricant. So if that's deficient, we're going to have increased hydrophilicity within the alveolar spaces and increased hydrogen bonding, collapsing forces, where you get lots of little areas of atelectasis, lung collapse. So they can give you the same question here, and the answer can just be increased elastic recoil. Now, because we have increased collapsing force here, it's simultaneously more difficult to expand. So we also have decreased compliance. Wrong fucking answer. Choice B, fluid within visual lines. Wrong fucking answer. Refers to TTN, transient tachypnea of the newborn, which will be the answer on USMLE if you get a vignette where it sounds like NRDS, but the kid is born at term via a Caesar. Okay, so there's 2 main mechanisms. The first is there's simply not enough time for the pulmonary lymphatics to clear the amniotic fluid out of the lungs in a rushed delivery, such as a Caesar. The second and more salient mechanism, in fact, is that the compression exerted by the vaginal canal during a spontaneous vaginal delivery normally has an expulsive effect of the amniotic fluid from the lungs, which clearly we're not going to have that compression if we're born via a Caesar. Wrong fucking answer. Choice C, increased lecithin alveolar fluids. Wrong, because in surfactant, our lecithin-sphingomyelin ratio, aka dipalmitoyl phosphatidylcholine sphingomyelin ratio, a higher ratio, 2 to 2.4 plus, is good. It indicates fetal lung maturity. So the USMLE can ask you any number of permutations of answer choices as far as what are you most likely to see? And we would say, well, decreased lecithin is bad. Decreased dipalmitoyl phosphatidylcholine is bad. Increased sphingomyelin is bad. All these things mean a lower ratio. So in this case, choice C, increased lecithin would indicate fetal lung maturity as opposed to NRDS. Wrong fucking answer. Choice D, increased number of lamellar bodies. Wrong, because lamellar bodies are the specialized organelles within type 2 pneumocytes that secrete surfactant. So going back to kindergarten for a second, the type 2 pneumocytes, 2 main functions. Number 1, surfactant production via lamellar bodies. And number 2, they're the stem cells of the lungs where they'll proliferate in response to lung damage, e.g. type 1 pneumocytes are destroyed, and what cell is going to proliferate in response? The answer is type 2 pneumocytes. So USMLE can give you the same question. The answer can just be decreased number of lamellar bodies. Sounds very nitpicky and weird if you haven't heard of it before, but it's not hard. Wrong fucking answer. Choice C, reticulogranular chest x-ray, correct answer. It reflects a ground glass appearance with lots of little areas of lung collapse, atelectasis. This is a buzzy term as per my observation across NBME questions for NRDS. Now, if you've been following my content, you'll know that I've discussed in adults, they like giving reticulonodular or reticular. Those 2 for pulmonary fibrosis. Okay, it means interstitial lung disease. However, if they say reticulogranular, that's NRDS. Very, very buzzy type of stuff you can memorize for USMLE. 12-line paragraph in a 55-year-old, dry cough, you're not sure what's going on. They say chest x-ray or CT shows reticular pattern or reticulonodular patterning. That's honeycombing. That's pulmonary fibrosis. Easy. However, kid born 29 weeks gestation, dyspnea, you're like, well, that's NRDS. And they'll say in the last line, there's a reticular granular pattern. You're just going to see it very frequently in USMLE questions. And even if you didn't know the answer here, you could eliminate to get there if you knew the other ones were wrong. Correct answer.